an emergency department transitional leadership project that we did for a client. This client was really looking for help with mentoring a new director and trying to make sure that we had some support for a director who was brand new to the emergency department. Really help them understand how an emergency department functions on a day-to-day basis, just with the operational part, but also to help them succeed in being able to drive their metrics. Determined that our best way to check and make sure that we were hitting leadership mentoring was, is the leader able to effectively, one, transition all of these changes and really lead and guide this work, making sure that we could improve overall patient experience. And by putting in some things such as rounding in the lobby for patients that were waiting to go back, making sure that we were touching base, keeping them informed. And then on our results pending space, same thing, making sure that they knew what we were waiting for, what the expected time frame was to be able to get those patients moved to the next step or eventually to disposition. So those were really the things that we looked at. Found that we had a decrease in our left before treatment complete, which resulted in 1,700 additional patients being able to be seen and complete their treatment, which is big. That's a nice number. But if they continue that same trajectory over the course of 2025, based on their patient population and volume, they will be capturing an additional $3.36 million. So a huge improvement in financial outcomes if they are able to sustain that, which I believe they'll be able to do based on the processes that we put in place. We did feel like that by the end of our project, our leader was truly an ED leader, not an inpatient leader who was functioning in the emergency space anymore. The chief nursing officer, chief medical officer, the system clinical officer, and the CEO for the hospital felt like we had done some great work with this leader to really improve their ability to advocate and speak for emergency department patients and really become the expert that she needed to be. So very successful in the end.